Welcome to another episode from the Veterinary Research Channel. Today, we're discussing a vital topic in veterinary medicine, the treatment of congenital extrahepatic portosystemic shunts in cats using a specific surgical device. Congenital portosystemic shunts, or shunts, are abnormal blood vessels that bypass the liver, preventing essential nutrients and waste products from being processed correctly. This can lead to a variety of clinical signs in affected cats. For cats diagnosed with these shunts, surgical correction is generally considered the treatment of choice for long-term resolution of clinical signs. This is because relying solely on medical management often only provides a partial or short-term response.
That's right. When it comes to surgically correcting these shunts, specifically those located outside the liver, known as extrahepatic shunts, several options exist. Surgeons can choose acute partial or complete ligation using sutures, or they might opt for a gradual attenuation method, typically employing devices like a thin film band or an ameroid ring constrictor. The key advantage of gradual occlusion with devices like these is that it significantly reduces the risk of potentially fatal portal hypertension, a serious complication that can occur if blood flow is redirected too quickly back to the liver. Ameroid ring constrictors work by stimulating local inflammation and the formation of fibrous tissue around the shunt, effectively closing it off over time. Some surgeons prefer these constrictors over thin film bands, partly because the bands can vary in their chemical composition, which might impact the cat's inflammatory response to the device. Previous studies evaluating the long-term outcome of using ameroid ring constrictors in cats have shown inconsistent results, which highlights the need for more data. The objective of the study we're discussing today was to report the clinical outcomes for cats treated with ameroid ring constrictor attenuation of an extrahepatic portosystemic shunt, specifically focusing on perioperative, short-term, and long-term results, based on cases from a single institution over a long period, and using a more standardized protocol.
This study looked at 20 client-owned cats with extrahepatic shunts treated between 2002 and 2020. Out of 26 cats initially identified with shunts, 6 were excluded because they had multiple acquired shunts, portal vein aplasia, or a complex intrahepatic shunt, leaving the 20 with single extrahepatic shunts treated with the ameroid ring constrictor for inclusion. The cat population included 13 males and 7 females, and the most common breed was the domestic shorthair. Their ages ranged significantly, from 4 months up to 8 years, with a median age of 11 months. Most cats presented with neurologic signs reported by owners or noted on examination, affecting 16 out of 20 cats. These signs included general indications of hepatic encephalopathy like ataxia, twitching, or abnormal mentation in 15 cats, seizures in 7 cats, and persistent or intermittent blindness in 5 cats. Prior to surgery, most cats were already receiving medical therapy, with 19 cats on lactulose and 14 on oral antimicrobials. 6 cats were being treated with anticonvulsants, 4 for ongoing seizures and 2 prophylactically. A prescription liver or kidney diet had been prescribed for 18 cats. Cats received medical therapy for a median of 8 weeks before surgery, although the range was quite wide, from 2 to 52 weeks. Notably, some cats showed improvement on this medical management, while others did not.
Diagnostic imaging was crucial in confirming the presence and type of shunt. Transplanic portal scintigraphy was performed in 19 cats, confirming shunting in all of them, with a median shunt fraction of 88.4%. 5 cats also underwent computed tomography, which confirmed a single extrahepatic shunt. Regarding the surgery itself, all 20 cats underwent an exploratory celiotomy, placement of the ameroid ring constrictor, and a liver biopsy. The size of the constrictor ring was chosen based on the shunt vessel diameter, aiming for a diameter slightly larger than the vessel at its insertion point to avoid acute occlusion. Most commonly, a 5 mm constrictor was used in 14 cats. In addition to the shunt attenuation and liver biopsy, 14 cats had other surgical procedures performed during the same anesthetic period, including procedures like gonadectomy or cystotomy. The average surgical time was around 72.5 minutes. Histologic examination of the liver biopsies consistently showed changes indicative of reduced blood flow through the portal vein, such as areas with small or absent portal venules and increased bile duct or arteriolar structures. Importantly, intraoperative complications were not reported in any of the cats in this study.
However, complications were noted in the immediate period following surgery. Perioperative complications were reported in 5 out of the 20 cats. These included central blindness diagnosed immediately after anesthetic recovery in 2 cats who were not blind before surgery. This blindness persisted throughout their hospitalization. 1 cat developed head pressing after recovery, a cat that had a history of neurologic signs preoperatively. Another cat developed serous discharge from its abdominal incision and was diagnosed with ascites the morning after surgery. This cat had low albumin levels preoperatively and attenuation of a gastrophrenic shunt. Unfortunately, one cat developed severe postoperative seizures 2 days after constrictor placement. Despite aggressive medical management, including various medications and constant rate infusions, intermittent seizure activity persisted. This cat ultimately suffered a fatal cardiopulmonary arrest 5 days after surgery, resulting in 1 death out of the 20 cases.
19 of the 20 cats survived to discharge from the hospital, typically within 48 hours after surgery. Postoperative medical management, including continued medication like lactulose, antimicrobials, and anticonvulsants where prescribed, and prescription diet, was continued. Short-term follow-up, defined as up to 6 months after surgery, was available for 18 of these 19 cats. Most cats were examined within 3 months. For many, medications like lactulose and prescription diets were discontinued after a median of 12 weeks. 14 cats were clinically normal at their short-term recheck and were no longer receiving many of these medications or the special diet. Preoperative blindness resolved in 1 of the 3 affected cats, and the postoperative blindness resolved within 2 weeks in both affected cats. Based on clinical signs and need for ongoing management, the short-term outcome was considered excellent in 14 out of 18 cats, good in 2 and poor in 2. The cats with good outcomes still required medication to prevent seizures or had persistent blindness. The 2 cats with poor outcomes continued to experience seizures despite medical management.
Long-term follow-up was available for the same 18 cats, extending significantly beyond 6 months, with a median follow-up time of 8 years and a range up to 15 years after surgery. Information was primarily gathered through owner questionnaires, supplemented by referring veterinarian records when necessary. Looking at the long-term results, the outcome was considered excellent in 15 out of 18 cats, good in 1 cat, and poor in 2 cats. The single cat with a good outcome was one that had developed seizures after stopping prophylactic medication early on. It remained seizure-free long-term by continuing daily medication despite having normal blood work. The 2 cats with poor long-term outcomes were those who continued to experience intermittent seizures despite ongoing medical therapy. One of these cats also remained persistently blind.
So, in summary of the results from this study, the long-term outcome was good or excellent for 16 out of the 18 cats who survived to discharge and were available for follow-up, representing a significant success rate of nearly 89%. Perioperative complications were reported in 5 cats, which is a 25% rate. The authors note that comparing outcomes across different studies is challenging due to variations in follow-up times and how outcomes are classified. However, they suggest that the improvements in perioperative management and the use of a standardized protocol in this study may have contributed to potentially fewer postoperative complications or a better long-term outcome compared to some earlier reports, where perioperative complication rates were sometimes higher. The most serious immediate postoperative complication observed in this study was seizures, which sadly resulted in the single mortality out of the 20 cases. Seizures are recognized as a primary cause of early postoperative mortality in both dogs and cats undergoing surgical treatment for these shunts.
Exactly. The precise cause of these postoperative seizures isn't fully understood, but potential contributing factors include changes in brain metabolism or neurotransmitter imbalances resulting from the altered blood flow before and after surgery. Interestingly, in previous studies, the presence of seizures before surgery hasn't been consistently linked to whether a cat will develop seizures after surgery. Prognosis for cats experiencing postoperative seizures is often guarded, with historical mortality rates reported as high as 34% in combined studies. As highlighted in this study, some cats may continue to experience seizures in the long term, even if their standard blood tests, like bile acid stimulation tests, complete blood count, and biochemistry, return to normal limits. One cat in this study developed seizures only after medication was stopped, but the seizures resolved upon restarting the medication. Blindness was another complication seen both before and after surgery. Blindness related to the underlying hepatic issue or seizures often improves over time, as it did for most affected cats in this study, unless the underlying cause is severe or progressive. Postoperative ascites, or fluid buildup in the abdomen, while reported after acute ligation in some studies, is less commonly reported immediately after placement of gradual attenuation devices like the ameroid ring constrictor. The single cat that developed ascites in this study had a specific type of shunt located near the esophagus, and it was suspected that the constrictor ring or its positioning might have contributed to pressure or partial occlusion of the vessel, potentially leading to the ascites. The authors do point out that this study is retrospective, which comes with limitations, such as variations in anesthetic protocols or referring veterinarian management. Also, achieving consistent clinical and diagnostic evaluation during long-term follow-up can be challenging.
Despite these limitations, this study provides valuable information, showing that surgical attenuation of extrahepatic portosystemic shunts with an ameroid ring constrictor can effectively resolve clinical signs and biochemical abnormalities in the majority of cats. However, it reinforces that seizures remain a significant concern and may unfortunately persist long-term in some cases, even when blood work appears normal. The authors conclude that prospective studies involving multiple institutions would be beneficial to further understand outcomes and identify risk factors for complications in cats undergoing this type of gradual attenuation surgery.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.